Dr. Juan Aguilera from UTHealth Houston at El Paso.
Thank you so much, Christine. I'm very happy to be here and also very moved by the presentations that have been shared. I think this is a time for us to come together, that we're facing a lot of challenges in the environmental side. And definitely, I hope that these opportunities to interact bring us together. Let me bring up my slides in just a bit. Do you see my presenter view? Perfect. Well, I want to share a little bit about some of the work we've been doing in El Paso. The focus for today is going to be also talking about local air quality. And this is a project where we're able to see associations with health screenings in low-income communities. So, as I've been talking throughout this presentation, I think that even though I'm in El Paso, Texas, it is very intertwined with New Mexico and this Paso del Norte region. I'm originally a physician from Mexico. I did med school in Ciudad Juarez, but then had the opportunity to study in El Paso. And after finishing my doctoral work, did also some work at Stanford, where I was able to learn more about wildfire smoke exposure. And now the opportunity to be back in El Paso and bringing some of the things I learned over there to some of the efforts here. And air pollution, it's something that we are really concerned about because we have been learning more in the last decades about the effects, not only for respiratory outcomes, but also for cardiovascular and immune cell effects. I mean, we understand now that air pollution, depending on the size of the particle, is how far they can travel into the body. And just to give some perspective, as you see in the image on the left side, when we talk about PM 2.5, we're talking about particulates that are less than 2.5 micrometers. So these are even smaller than our blood cells. And the fact that it can go from our lungs, emerge with our circulatory system, and eventually be causing inflammation, we're gonna know that now they puts us at risk as well for cardiovascular disease, stroke, heart attacks, and it's just one of many environmental factors that, when taken together, can put communities at risk. I mean, the associations beyond like increased respiratory disease, we're also seeing links with diabetes. Talking about children, we're also seeing that there's arterial stiffness. That means that with increased exposure, they're having effects that can be later turn into high blood pressure or hypertension. But even things like the academic performance can be affected by these exposures. And we saw that through the exposure of air pollutants and physical activity. So even though we know and understand that physical activity is good for us, it's going to decrease the risk of cardiovascular disease and metabolic syndrome, this outdoor exposure in days where the pollution might be high can also increase, number one, the amount of breaths you take by minute just because of the exercise you're performing. And then with this increased air pollution, this risk for cardiovascular, respiratory, and lung problems. In children, this is really important because when they're starting at the young age, their health habits are being set up for adulthood. So we do want to encourage them to do physical activity and emphasize how important it is. But then when you add a layer of children having asthma attacks, having that risk of being affected by the air pollution, it can trigger some negative effects and anxiety just based on the exposure. I won't share the details of that specific study we did, but we did found that with increased air pollution in El Paso, at least at one of our schools, there's less time spent in physical activity. But another aspect I wanted to touch is also represents for our tribal lands. I mean, often we understand that there's been policy changes and there's been disproportionate exposure just because of the tribal lands being located near highways, mines, oil and gas operations, or burning areas, which is going to lead to an increased exposure. But then often we don't talk about like the sovereignty of the tribes. And I mean, they will benefit of having authority for air quality monitoring and environmental policy and enforcement on their lands. And I mean, often they are not included in data systems. They usually not part of like the regulations for cities or regions to be under compliance with federal guidelines. And I mean, without that, there's less support for their traditional lifeways. Going a little bit on a tangent, talking about wildfires, I mean, it's increasingly important to understand their cultural practices because they have done practices that include prescribed burning and control and mitigation for wildfire. And for us to start to understand that and meet them where they are, I think is something that hasn't been done enough. And now with the increased heat, with the increased climate, this is becoming more and more important where we need to understand these practices and just come together because if government agencies are just trying to do it without considering these practices, there's this duplication of efforts that is not necessarily useful because there's no coordination. And I mean, they've been in this region for many, many years, and they will understand this. But also there's impacts for mental health. I mean, despite all the physical implications, there's also higher risk of anxiety and depression. As I mentioned, there's stress and inflammation that's going to come into our bodies just because of these small particles. And now we're learning about these cognitive and sleep disruption effects that we're seeing with the poor air quality. So there's definitely an overall effect on our bodies just because of the exposure. So, for example, in El Paso, just because of that desert setting, larger particles are very prevalent. And it's very difficult to be in compliance for that. But also we have traffic from the border. Traffic emissions because of the heavy traffic just coming into the border region through diesel trucks, through traffic and transportation is going to increase the chances of us being exposed to traffic pollution. And with those vehicle exposures and pollutants being into the atmosphere with increased heat, then there's going to be more ozone as well that does transform uh, these these pollutants. So to share a little bit of our perspective, we started with a study looking at health outcomes in the region. At first, it was just 600 participants where we were visiting housing communities, and we were measuring things like glucose, cholesterol, triglycerides, blood pressure. We wanted to learn more about the current health and state of chronic diseases. But then the opportunity came to combine this with air quality monitoring. At that time, there were about 6 stations in El Paso, which are the ones that we use to compare, well, what do these outcomes have to do with air pollution? And we did find some associations specifically related to obesity and glucose. Even though air pollution doesn't directly have these effects, we were still seeing them just because of their conditions. But then there's limitations with the central air monitors. I mean, as we noticed from the map, they were very sparse out through the region, and that continues to be the trend. So for another project, since we had already about say 5,000 participants before the pandemic, as you can see from the map, all of them with health outcome data, we wanted to include more information and to compare better in regions where there were no air monitors. So we did mapping to consider, for example, how far they were from the border bridge, which is tied into pollution, how much traffic is in the surrounding neighborhoods for these participants, how much streets were close to the participant neighborhoods around the areas where they're living. This allow us to combine all this information basically into a model that considered traffic variables as a proxy for air pollution. And when combined with our health data, we're able to identify hotspots that are going to be telling us a story about the increased likelihood of chronic diseases or metabolic syndrome. So with that, I mean, this is important because these assessments allow us to see how exposures to traffic emissions are in the communities and how can we assist them and improve on our models. I mean, these models, our goal is now to pair them with clinical outcomes and increase the monitoring because in the Paso del Norte region, we have very few monitors for air pollution and we do need to do more. I mean, the recommendations is to have better landscapes, more trees, more barriers that are going to protect our health. And with that in mind, we can do better to protect our communities. And only by working together, we can find solutions to all of these complex problems. So I do hope there's time for us to collaborate. And I thank everybody here for their attendance and attention.
Thank you so much, Dr. Aguilera. We have questions. One of them is, in New Mexico, we face a seemingly annual challenge of deciding whether to use our swamp coolers and get smoke indoors or avoiding them and trying to keep the smoke out. What do you recommend to people?
My recommendation is just to be aware of how you're feeling within your own household. Efforts that have been done in areas where they're exposed to wildfire smoke is to consider investing in air purifiers. They have been becoming more accessible as regards to pricing, but even for our communities that do require to make their own. We've been finding instructions online where they can combine like simple filters from the warehouses or like Home Depots and just tie them up to fans. So even though you might need to use evaporative coolers and you don't have access to refrigerated air, I mean, I would opt out to protecting yourself from the heat when it's that extreme, but then using that aside to complement and improve the air quality at your home. And you're muted, Christine.
Oh, sorry, thank you so much. In attempting to increase their physical activity, what measures can people take outdoors to be active while trying to protect their lung health from air pollution exposure?
One of the things is to start with the awareness. As we understand that there's air pollution and there's days where this air pollution is increasing, we can always monitor the AQI and then try to align our physical activity routine to be done in areas where there's better air quality air and even at times where there's less either pollution from traffic or we can have that improve air quality. If by any reasons like the dusts are like really high or the pollutant levels are really high, then you can do like a combination at home where you might do like other forms of activities and then later on return to the regular pace.
We have another question that connects to some conversation from earlier, but with the recommendation to plant trees as a shade structure near housing and residential areas, how does that relate to maybe an increased wildfire risk in those high heat conditions?
So usually when we do the recommendation to include more shadings, more trees, they're gonna act as barriers, and we usually recommend those in corridors where they're gonna be protecting some communities. Usually there's also recommendations of how well they're spaced out, and usually when they're located within like inner city areas, there's irrigation practices that are needed to maintain those trees. Usually the wildfire risk comes with drought, and trees turn to burn faster if they are not irrigated. So that's why the humidity is very important and how dry or how well irrigated those trees are. So there's less risk in the inner cities just because of that.
Thank you so much, Dr. Aguilera, for your research and your time here today. I'm going to now hand it off to Nate Matthews Trigg to
Actually,
continue the modern.
Christine, is it okay if we ask the question from Christopher? Because we have another
Oh, of course, please. Oh, we have,
Christopher Ramirez from Together for Brothers.
oh, I have, isn't the cumulative impacts, um, or how are we able to disaggregate impact of air pollution when the most impacted communities are also impacted by other factors like food insecurity, healthcare insecurity, heat, and other factors.
This is why it becomes increasingly important to act together and work understanding not just the physical environment, but also the environmental conditions. Meaning, we don't need to study these things isolated. We need to understand how they are affecting communities, but then what other things are communities affected by. One of the things we saw with air pollution, even at the short term, it wasn't necessarily that breathing polluted air was increasing your risk for obesity in the last 24 hours. But if you're living in a neighborhood that has that increased pollution, your neighborhood conditions likely have food deserts, you don't have access to good quality diets, you might have a routine that does not allow you to have a healthy physical activity pattern. So all of that adds up, and this is important where we need to address them within communities at both the individual level and community level, considering all of these aspects.
Incredible. Thank you so, so much. Okay, I will hand it now.